Let me say good afternoon, and Dr. David Persse, of course, is here, and Dr. Persse is our point person for the city of Houston in dealing with the coronavirus, especially in all of our medical health needs. And then we have Senator John Cornyn is present, and Congresswoman Sheila Jackson-Lee. Let me just make a few comments, because in the last, let's say, 48 hours since Wednesday, when we had the first case in the region in Fort Bend, and then we had the cases on yesterday in Harris County. And then, of course, last night we got confirmation with respect to the case in Houston. So we have the case in Fort Bend. I think there are 3 cases in Harris County, and now there are 2 in Houston. But what I want to say to people, and when you're getting all of this at the same time or within a 48-hour period, it can create anxiety. But what I want people to bear in mind, there are common denominators with all of these 6 cases in Houston, Harris County, and Fort Bend. All of these individuals were on the same trip together, the same international trip together in Egypt. So they were all of the same group. And we have been monitoring their situation for the last several days, if not a little bit longer than that. They have been either self-quarantined or they've been hospitalized when their situation may have gotten worse. So I want to assure people of that, and that's something that we can't say enough. We can't say enough, and want to remind people. We've also, over the last couple of months, we've been talking with the Texas Medical Center, with medical personnel. We've been making steps preparing for this particular moment. And so we want people to just bear in mind that international trip, all of the same group. Okay? Outside of those cases, there have been no other cases. Now, probably from people who are on this particular trip, there will probably be some others, because of a total of 17 that are in the Fort Bend, Harris County, City of Houston area, total of 17. And we are monitoring all of those cases as we speak. For the rest of those in Houston, in Harris County, Fort Bend, in the region, it's of low risk. And there's no indication of any community spread. And so I want to emphasize that, because I look at my social media and things can take off, okay? So I want to emphasize it and want to speak to it. That's why we're holding this press conference. And that's why when we get a confirmed case, like we received last night, we immediately want to indicate it to my staff, send out a press announcement right then. Let's not wait until tomorrow morning. So if we get a confirmed case, so to speak, even if it's 9:59 p.m. at night, we are going to send out a press announcement. Or if it's later than that, we're going to send out a press announcement. Because in situations like this, we are only as good as our own credibility. And what I want to assure people is that we will be transparent, we'll be open, and we'll let you know. So outside of the individuals who were on this international trip together, there have been no other cases reported. And there are no indications of any community spread. And for the rest of everyone else, it's low risk. Now, if by chance, for example, you've been in contact, for example, with any of these individuals or people that's been on international travel, or if you've gone to some of these countries that have been, for example, on CDC list, and then you're starting to experience any symptoms or signs, then what I would urge you is to contact your doctor, and then your doctor can tell you, give you the protocol of when to report, how to go to come in. Or if, for example, you just feel real ill, have a hard time breathing, then by all means go and seek immediate help and go to the emergency room. But we always encourage people, for example, to call in ahead of time, so that our medical personnel, hospitals, clinics can take the necessary steps to keep everyone safe, and even those who are providing the necessary care and treatment. I have said before, like I said yesterday, because of the common denominator with people being on international travel, I'm pretty much asking people to curtail their international travel. Okay, I'm asking that, to curtail your international travel. In the meantime, in my conversations, for example, with Bill McKeon over the Texas Medical Center, with other healthcare providers, talking with Dr. Persse, and Dr. Persse and his team provide me with notifications and reports every 4 hours, okay? Because I want to stay abreast. We are taking the necessary steps to keep people safe. We are encouraging staycations, okay? Spring break is coming. For some schools, it starts next week. For others, it's week after next. And I know people have made plans to leave the country. But I'm going to ask you to stay local, okay? Staycations, take advantage of the discounts that the hotels in our region are providing. Take advantage of them. And then continue to live your lives and not be paralyzed by fear. That's important, because what I'm hearing is that people are running to the stores and buying everything, and let me caution people about raising prices at this point in time and taking advantage of the circumstances and taking advantage of people's fear. So let me advise people, don't be price gouging, what you call it, gauging, gouging, you know what I mean. Okay, so want to remind people about that. And then lastly, before I bring on Dr. Persse, I do want to thank Congress. They're moving forward on close to an $8 billion package in funding that will help states and local governments ramp up even more. And so everyone is pushing forward to make sure that we do everything possible to keep people safe. Now let me stop and let me bring up Dr. Persse.
Thank you, Mayor. And, thank you, Senator and Congresswoman, for being here. This is a community effort. We have been through difficult times before that have stressed our healthcare system. And here in Houston, that has generally been due to weather-related events. I've been here since about 25 years almost now, and I remember Tropical Storm Allison, where we lost 5 major hospitals within 3 hours of each other due to flooding. And this community came together, and we were able to provide care to everyone who needed it. With the hurricanes that we've had over the past several decades and the other flooding events that we've had lots of challenges and a surge of people looking for care. We've had hospitals that had to go offline, clinics that have been flooded, so on and so forth. And we have always been able to make it work and take care of folks. And as a result of that, we have a really cohesive healthcare organization between city government, county government, and the healthcare systems, of which you know that there are several and they're very large. And on a non-disaster period, they're kind of in competition with each other. But during disasters, we come together and we work really well together in order to protect the public. And we've always done that, and this is not going to be terribly different. We actually also had H1N1, and you remember there were a lot of parallels with H1N1. When the numbers first came out, it looked like there were some pretty horrible consequences if you got bit by a mosquito with H1N1. Fortunately, in the end, that turned out not to be the case. Zika was similar. That was another mosquito-borne illness, but with terrible consequences, and we were able to manage it here in this community because we came together. We've done this before, we're doing it again. With this particular virus, the numbers are a little bit scary right now. We all agree to that. That's why it has our attention. At the end of the day, it's still a virus, which means if you wash your hands, you cover your cough with a tissue or your cough into your elbow. You don't go to work if you're ill. That's very important. Don't send your child to daycare or to school if they're ill. That's very important. Viruses behave like viruses. We know how to take care of that. We know how to slow them down or stop them. And I would draw your attention to MERS and SARS and Ebola. Now those were 3 very devastating viral illnesses for the people who got them. And they don't exist like they did at one time. SARS is basically gone. Ebola is still around in some parts of Africa, but they're able to stay on top of it. MERS is still around in the Middle East, but they're able to stay on top of it. And that's because the government is doing its part with its public health practices, but just as importantly, the people in those communities are doing what they can do to slow down and stop the viral spread. And at the end of the day, when both teams do their job, that's how we have stopped these epidemics in the past, And that's how we're going to be able to win with this one as well. Thank you.
And then I'm going to bring up Senator Cornyn and the Congresswoman. I too want to remind people, this is the same city in the same region that dealt with the tax day flood, same city, same region that dealt with Harvey, and literally thousands of Houstonians and others were in shelters, and thousands were displaced, and we dealt with that. And we did it as a community, and we supported one another. And my greatest concern is not that people will come down with the virus. My greatest concern is that people will be paralyzed by their fear. That's my greatest concern. It's not that people will get the virus. It is that people will become paralyzed by their fear, and they will allow their fear to take control. And so just want people to kind of take a collective breath, okay, and allow us to do our jobs and provide you with the information, credible information, and not feed on social media. Senator Cornyn?
Well, Mayor, I think those are wise words. We have other choices other than panic or doing nothing. And the smartest choice, as the mayor said, is to be vigilant. As Dr. Persse said, exercise the kind of good hygiene that your mother taught you growing up. You know, wash your hands. If you feel sick, go see your doctor. But obviously, the response we've seen in the markets has been pretty dramatic, and I think it's been largely driven by fear, not the sort of rational, common sense approach that the mayor talked about. But just two things quickly. I've talked to the President of the United States, the Secretary of Health and Human Services, just off the phone this morning with all the Texas hospitals, and everybody's sharing information, trying to know what we're dealing with and try to be prepared and handle this in the most intelligent and effective way possible. And Sheila Jackson-Lee and I in Congress have voted for $8.3 billion in additional aid, one, to try to come up with a vaccine to try to protect people from this virus. That's going to take a few months, perhaps maybe longer, to come up with, but in the meantime, to try to make sure that this virus is contained and that our healthcare providers have the resources that they need in order to treat patients. About $950 million of that $8 billion is available for state and local governments to reimburse them for their costs associated with this outbreak. And I'm proud of the work we've been able to do, again, on a bipartisan basis to make sure that Texas and the nation has the resources that we need in order to deal with this challenge. San Antonio has been particularly a hot spot because of the people quarantined there, but now I think all of the people that were in quarantine have now been released. And so, as the mayor said, I think the smartest thing to do is don't panic and don't do nothing. Try to be smart about this, follow the instructions of healthcare professionals, exercise good individual hygiene, and call your doctor if you are experiencing symptoms. That's the best way to get on top of this.
Congresswoman.
Thank you very much. I chair the House of Representatives Bipartisan Task Force on the coronavirus, and we have stated that our position is not to panic, but to be prepared. I thank Senator Cornyn. It's important for you to note that the $8 billion plus $300 million is an expedited process. The President has signed the legislation, and those monies are ready to be distributed as needed. I think it is also important to emphasize the difference here from Washington State. No community spread, no one walking around and getting it from someone else walking around. That's important to tell your family, to tell your coworkers, your children in school. That is an important statement. And we're trying to make sure that nothing like that happens. So there are several things that I'd like to comment on just to reinforce. The elbow, the bump is important. I know that we are loving people, and I've seen a lot of hugs in the last couple of hours. but we've got to learn to bump and to utilize elbows and other new tricks. Somebody said tap them on the foot. The other is that we now understand that we should not let those with light symptoms just remain without being seen by a provider. So now we want people who think they have symptoms. Again, we don't have any community spread. These individuals have come from travel. But if you have those symptoms, please see a provider. We do not want people to self-diagnose themselves. We met with the Vice President about 2 days ago, who indicated that we're going to be working to do, as Dr. Persse and the mayors wanted us to do, is to internally produce masks here in the United States and protective gear. We hope that we can see the production of that sooner rather than later. They delivered yesterday a huge number of masks to Washington State that are produced here in the United States by 3M. Lastly, I think this is very important. There's been some question about the test kits. When you hear the word 15,000, the test kits are multiple. So if you have one test kit, it can test a multiple of people. That's where the numbers come from. But the good news is, and I'm hoping in your discussion, Senator, and that this will come from the CDC, that the CDC is going to allow hospitals, research universities to work on test kits and to be able to utilize those test kits. Being here in Houston, Texas, with the greatest medical center in the world, that's going to be a great asset for the city if it is necessary, but it'll also be a great asset for the nation. So we are not panicking, we are being prepared. And I think that's how you should carry forward your life and your lifestyle, is to always be prepared and not to panic. We go back to Washington again, and we'll be working on other issues, and one of those are issues dealing with anyone who feels that they have to stay home, they're an hourly worker, or they have the need for resources. We're trying to be able to assist those people who cannot support themselves without their weekly salary. So we're hoping that all of this work, with all of us working together, particularly the health professionals, those are the leaders, those are who we're going to be following, that's who you should be listening to, that we in the city and the nation are prepared, we're not going to panic.
And in closing, let me just say the Houston lab can test, and we have been in conversations, for example, with Bill McKing and the Medical Center and others, in ways of increasing our capacity in the city to test. So we're working at that, on that. Will there be more cases reported in the Houston area? Probability is yes, okay? But what I would say to you, if I can analogize like the flu, okay? There are many cases, okay? But what's happening now, because we want to be transparent, that when cases are reported, we let you know. And so people are hearing, let's say, a case today or two tomorrow. And when you're constantly hearing it, it kind of feeds. And that's why, you know, we'll hold these press conferences as often as we need to, and we'll talk to you as often as you want to talk to us, to make sure that we are providing up-to-date information. And the circumstances should change, for example, where we're dealing with a situation where it's not a group on the same trip traveling together, and it goes beyond that, we'll let you know that, but that would be a change in circumstances. But we are certainly working every day to make sure that we enhance capacity, especially for testing. And if someone feels ill, though, and please contact your doctor and then follow the proper protocol. Okay? Any questions from anybody?
Yeah, Mr. Mayor, in the interest of transparency, can you tell us how many cases, possible cases, the city and or county are monitoring right now? I understand it's actually north of 100. I'm not
aware of 100, Dr. Persse.
So, Joel, good question. As you know, we don't talk about possible cases. We only talk about cases when we have them. And there's a couple of reasons for that. And I'm going to use a real-life example. So in College Station, there was a case of somebody who they thought was a potential case, and they talked about that. Okay, that was not a case. That got reported, and for a long time, people believed that was a case. And people tried to hunt down that individual. All right, and that's a problem, because when we think that when there are people in the community who think that they may be a case, they need to feel comfortable coming forward so that we can, get them isolated if they need to be, and then do the contact tracing and all the work that we need to do. The worst thing we can do is have an environment in our community where people are afraid to come forward. And so we draw a hard line in that we will talk about cases, and we won't talk about anything before that. And it's just to be consistent. And this has been our policy at the Houston Health Department, and our colleagues with Harris County have the same policy. We don't talk about anything other than confirmed cases. So I know that's frustrating, because you want to know that's a logical question. I understand. But in our keeping with our policy, we don't talk about anything other than confirmed cases, because we have to protect the confidentiality of the people who come forward to make sure the next person will feel comfortable coming forward.
With that in mind, one follow-up. Can you at least tell us, we were talking about a closed loop yesterday of these people who were on this trip. Can you tell us how big that population is? How many people were on that trip?
We can say that.
Yeah, that's all.
17.
17.
17.
You're in touch with all these people?
17 that are in our region. 17, when you include Fort Bend, Harris County, and Houston, is 17. And just in response to, Joe, what you asked, that first question, and let me tell you one of the reasons why we don't do that. Over the last several weeks, there have been people that thought that they had it, and I was aware, and the health department and everyone let me know that they were testing, and those cases all came back negative. It was not until the Fort Bend case came forth that we had a positive result. But there were several instances where people thought, and they were tested, and the specimens or the samples were sent to the CDC, and they came back negative. So we don't talk about what possibly may happen, because then that feeds also into the fear that people may have. But it is important for us, when cases do come back and they are positive, for us to get that information out to you so in real time, and not hold on to that information.
Sorry, Senator Cornyn, we got to grab you for your next meeting.
Any other questions? We need to wrap up.
I wanted to ask.
Thanks.
I wanted to ask about the people who are hospitalized right now, too, in Houston, right? I wanted to ask about their symptoms. They're hospitalized right now. So everyone has had the cold. How do those symptoms differ from the cold? Can you go a little bit more in depth to kind of humanize what actually hits you when you do have this?
So you've asked a really good and very important question. So the symptoms that we're seeing with the people who have it, first of all, it's important that somebody has a travel history, particularly in this community now where there's no spread. So somebody would need to have a travel history to a place where there are cases. So that would be one thing. And then secondarily, the most common symptoms that people are having is a fever and then a deep cough. So the cold generally causes nasal congestion. And I just had a cold not too terribly long, and it's a lot of nasal congestion. With this, it's more of a deep cough. So there's not so much the nasal congestion, which you would see with a cold, but it's the deep cough. Now, the other thing, though, that's going to complicate things for us locally is that, things are in bloom. And a lot of folks in this area have got allergies, and people respond a little bit differently to their allergies. And so we do run the risk at this point of people being really concerned that they've got it because they've got, the deep cough. So right now, today in Houston, you really also need to have had that travel history to be of concern. If you haven't been anywhere or been around anyone and it's allergy season and it feels like it's your regular allergies, guess what? It's probably your allergies, okay? But if you're concerned, though, you should reach out to your healthcare provider, your doctor. We ask people not to go to the emergency department for this. It's not an emergency, and we need the emergency departments for the true emergencies. So please reach out to your doctor, just like the mayor said.
And last on closing thought, just bear in mind, in the city of Houston, let's say there are 2 confirmed cases right now. Bear in mind there are 2.3 million Houstonians. So again, I'm encouraging people, go about your lives, but exercise common sense and proper hygiene. That's critically important. Thank you.
One last one. Did they come back to IAH when they flew back? Was that to IAH?
That I don't.
Yeah, so I'm not going to answer directly, but it was an international flight.
Yes, it is. One last thing I wanted to ask about HCA, Houston Healthcare, sent out a memo about new policies when it comes to patients visiting hospitals, and I know Senator Cornyn said he was on a call about that today. I don't know if you guys would be able to share some insight
I've not seen it.
Policies.
We'll take a look at it.
As far as only 2 visitors to patients and things like that.
I'm not seeing that policy.
You're not familiar.
Let me just say this, that we're allowing state and local officials, state hospital systems, to make plans that will help them. I think the main issue from the federal government is we want to reimburse these individuals as part of the money. We want to give them the latitude to help locally which is one of the reasons why once, I think, Kirkland, Washington, where the nursing home was, and we should emphasize that the persons who have died have had multiple ailments and were older individuals. We don't want to dismiss that, but we want to be able to give to local communities, what do you need? And that's part of what this money is going to be, to give you all what you need, and particularly the protective equipment. And different states are making different policies. On the federal level, we want to make sure that our airport personnel, CBP, are questioning people that are coming in from the areas that have been designated as having the coronavirus, from Italy to Egypt and various other places. They must question them about their travel.
Mayor Turner, you want to wrap up?
Yeah, and then lastly, and Dr. Persse, correct me if I'm wrong, in terms of the profile of people with coronavirus, not seeing much in children,
Right.
not seeing much in young people, you know, college students, university, not much at all. That profile is that older population, because all of the people that we are talking about in Fort Bend, Harris County, Houston, are, let's say, at least 60 years and older. And so, you know, I want to say that because, you know, we're not seeing much of an issue with students, you know, elementary, junior high, high school, college students, or even slightly older population, people that are about my age, you know, 40-ish, you know. give or take, you know. But the profile of people who we really, you know, I'm mindful of is more senior, like 60 years and older. And that's why what I've said repeatedly, I am certainly expecting nursing homes, senior living facilities, those institutions, organizations to have a preparedness plan. Okay, all organizations, but particularly sensitive to that, and indicated to Dr. Persse, want to make sure that we are communicating with our senior living facilities and our nursing homes and seniors to make sure we're watching, you know, we're taking good care of them. But for our students, college, universities, high school, junior high, elementary, that's just has not been in that most vulnerable population. Is that a fair assessment?
Yeah, so the population that we worry about having the worst complications are exactly as the mayor said. It's the older population. And locally here, they were all related to this trip, which happened to be a group of folks of about the same age, which is a more mature group. And so that's what we're seeing here locally. And so, you know, heaven forbid that we get a lot of spread here, then it's a virus. So people of all ages could become infected. But again, as the mayor pointed out, that it's the older folks that seem to be having the most problems with it. In China, they've had it, you know, people of all ages have been infected, but the younger folks, really below 50, seem to be able to, you know, get over it pretty much without trouble, but 50 and above seem to have the most complications. So that's the group that the mayor is pointing out, the nursing home patients and so on and so forth, that we worry about because they're the ones that seem to be having the most complications from this particular
And for
virus.
those that have been hospitalized in the area, and I don't think can I say that they're stable?
Yeah.
Yeah, I don't want to violate HIPAA requirements, but for all of those who have been hospitalized in our area, their condition is stable. So I just want to let people know that. Okay, thank you all so very much, and we'll talk to you as often as we need to because it's just important that people get accurate and factual information.